discuss this more with Dr. Omer Awan, a physician and senior public health contributor for Forbes. Appreciate you joining us.
Thanks for having me.
So you just wrote a piece for Forbes about this rise in vaccine hesitancy, highlighting a recent Gallup poll that shows 69% of respondents view childhood vaccines as extremely or very important. That is down from 94% in 2001. So why do you think fewer people now consider childhood vaccines important? And what do you think is behind this dramatic drop in the last 2 decades?
Well, it's really complicated, Rosemary, and honestly, part of it has to do with the politicization of vaccines, particularly during the COVID-19 pandemic. We had Republican and conservative leaders that framed vaccine and vaccine mandates as an overreach of government power, whereas more progressive and liberal leaders framed it as a way to promote public health. And this really caused a stark divide between Republicans and Democrats. And what happened was we have different messaging and mixed messaging between these leaders, and this confused a lot of the American people. And quite frankly, people were reluctant to get vaccinated because of the different messaging that took place. And this was also compounded by the fact that there's so much vaccine misinformation out there. I mean, honestly, there are so many Americans that believe that vaccines cause autism. There's so many Americans that believe that if they get a shot, they're going to have a chronic, debilitating disease for the rest of their life. And we, of course, know that this is not true. Vaccines are extremely safe and effective, and this is what evidence shows. So it's very important for all of us public health officials to debunk these myths that are so pervasive in American society.
So, Doctor, what will be the likely consequences of fewer kids getting childhood vaccines or any other vaccinations?
Well, people are going to suffer. And what's going to happen is that, these diseases that were eradicated will then resurge again. And this is already happening with measles, which was thought to be eradicated in the year 2000. But now we have close to 300 cases this year alone. And I'm very concerned about those that are vulnerable, because vulnerable populations rely on herd immunity to stay safe. So we're talking about people like babies or infants that can't get vaccinated. We're talking about those that have weakened immune systems, like patients that have AIDS or HIV, those that are bone marrow transplant recipients, those on steroids. They can't get vaccinated, and they rely on others to get vaccinated so they can stay safe. So what's going to happen is that these people are going to get sicker because people aren't getting vaccinated when they should.
And, Doctor, you also write about vaccine hesitancy finding its way into the Louisiana Department of Health, where public health workers are apparently no longer allowed to promote certain vaccines to the public, and that is including those for COVID-19 and the flu. What happens when health workers stop promoting vaccines, and do you expect some other states to do the same?
Well, first of all, I think it's extremely ironic that the Louisiana Department of Health is not promoting public health with respect to vaccines. I mean, it's because of vaccines that we've been able to eradicate so many devastating diseases like measles and polio. It's because of vaccines that we've been able to get through the COVID-19 pandemic. I mean, research shows that the COVID vaccine saved at least 14 million lives. And to put that into perspective, that means that 14 million would not be alive today if it wasn't for the vaccine. So I think it's very troubling. I think it is a trend that hopefully will not spiral out of control. And it really should be an impetus for all of us to do good with public health and to spread the good word that vaccines are absolutely safe and effective.
Dr. Omer Awan, thank you so much for joining us. We appreciate it.
Yeah, my pleasure.